My name is Mutumba, and I want to bring you up to speed with our interventions for 2022. First of all, I want to be very, very grateful to our partners who have worked with us for the last 12 months. Our year had a lot of successes and challenges, being the fact that we were recovering from COVID and with the meager resources and the many challenges that COVID created in our communities. We have struggled to implement, but I'm happy to report to you that we have registered a bit of successes amidst such challenges. Our partnership has continued to grow with some of the funding partners. Currently, we are funded by USAID to implement the USAID Improving Care and Resilience for Children, but also funded by Global Fund through TASO as the principal recipient to implement an HIV, COVID prevention and TB grant that we are currently implementing in 28 districts. We are also funded by GOAL with funding from MasterCard to implement a Young Africa Works program in northern Uganda, in six districts in northern Uganda. And currently, again, we are funded by Children's Homes to implement a young girl and young women empowerment program. These programs have enabled us to reach as many beneficiaries as possible, and our interventions have been categorized in 4 themes. Our livelihood theme has reached over 5,000 community beneficiaries, and in here we support micro enterprises at household level for caregivers, but also orphans and vulnerable children. We have been able to strengthen skills and build capacity of workforce, for workforce, and doing this we do through partnership with local artisans, but also very formal training institutions that equip young women and young boys with skills to earn a living. We have done a lot of linkage, and it is actually starting to show that linkage is a very effective approach to programming. In our programming, we can't do everything, and so we find ourselves building partnership and linking our beneficiaries to different providers and players in the field. This has supported and enabled us to reach as many as 5,000 beneficiaries in that livelihood thematic area. The other work that we have seen ourselves have input is health, and our health goal aims to see that our beneficiaries and communities are healthy and their well-being is good. And here we do a lot of referral strengthening and linkages with other providers. But I also want to state that we have built a lot of partnership with government institutions, the health facilities and hospitals, but also not-for-profit facilities and faith-based organizations. In here, we have been able to support children to access HIV care and treatment, but also do linkage to other communicable diseases. We have been able to reach close to 62,000 beneficiaries, both children and adults, with HIV prevention, TB, and other diseases. And the biggest arm here and strength has been the linkage arm. And we work with many linkage facilitators at facilities, but also use our community structures. We have built capacity for over 2 years for such community structures to deliver the services that we deliver at community level, at household level, but also at facility level. The other component of our work is water, hygiene, and sanitation. Here we have done a lot of work, but through partners. We have a partnership with Water for Life, and we deliver water services at household level, but also do a lot of awareness creation to be able to maintain the health status of many of the households that are benefiting from our programs. Our water and sanitation program has enabled us to reach over 5,000 beneficiaries still, and the bigger component here has been behavior change. We have also done rights and accountability programming, and here we have been able to reach as many beneficiaries as possible still with our rights and violence prevention programs. A partnership with very high-level institutions like police and probation officers have enabled us to do child protection, and we have built capacity of child protection structures at community level, but also at district level. We are continuing to do coordination and capacity building this year, and borrowing from 2022, our coordination has really given us results, because again, the fact is that we cannot deliver every service as an organization. So partnership and coordination becomes a very core mandate and important piece of our work. We will continue to do a lot of work this year, of course, with the funding commitments from our donors, USAID, TASO Global Fund, Gold MasterCard, and TDH, and we are planning to do more in more of the districts where we are currently operating, but also we are planning to expand to other districts. I want to convey special appreciation to our partners, especially the district local governments that closely work with us, with support from ministries, Ministry of Gender, Ministry of Health, but in a special way our funding partners, USAID, our funding partners, Gold, MasterCard, and TASO Global Fund and TDH for the support they have given us. We, as we cross to 2023, our biggest strategy will be building more partnership with such agencies that are delivering almost similar services, but also those that are delivering what we don't deliver. I think we need to innovate a lot and learn from our work, and the commitment from 2022 to 2023 is being as adaptive as possible and learning from our programming and seeing how the learnings from our programming can inform the future design and strengthening of our interventions. With this, we are very, very grateful to those who have supported us technically and financially, and we are also grateful to our staff, board and management for the work that we have been able to do in our communities. Thank you.